Thank you for the opportunity to present the research findings to moderator Mr. Dr. M. Amin and Dr. M. Shaifudi, PhD. Appreciate also to the Palembang City Health Office, Dinkes Kota Palembang, and the Palembang Statistics Center of Bureau, BPS, for the data provided. My name is Ahmad Kifari. I'm a lecturer in the Faculty of Medicine at Muhammadiyah Palembang. Our title for today is the mapping of high-risk district with economic, physical, and environmental vulnerable factors to COVID-19 infection in Palembang City. So we will discuss how the spatial analysis can be used to reduce the impact of pandemic. As an introduction, the World Health Organization, WHO, has not yet declared the pandemic to be over. COVID-19 continues to spread over the globe. The number of confirmed cases skyrocketed, followed by a huge number of deaths. So as for today, approximately 680 million people have been tested positive for COVID-19 and 6.55 million have died as a result. The inadequate ventilation, which deprives patients of oxygen, as well the viral infection and coagulation events, demand the utilization of specialized ICU management area, therefore so many death cases in this disease. The effective pandemic control is combining pharmacological and non-pharmacological intervention. So to rise up the capacity, we need to perform isolation, quarantine, stay-at-home orders to lower the infection rate. And while a better hospital and ICU personnel can raise up the capacity towards transmission and death rates. The goals of our research was regarding Palembang risk of pandemic, concerning their capacity and the vulnerability in the town, using the analysis of spatial for a better visualization. As a material and method, the observational analytic study using an ecological approach design is employed. Total sampling data from respondents was gathered in September 2021 using the secondary epidemiology data from Palembang City BPS and the Palembang City Health Office, also the South Sumatra Province. Geographic analysis is an assessment for vulnerability and adaptive capacity in reference to the sub-district transmission level. The environmental, physical, and economic vulnerability category was determined using standard deviation analysis. So here are the results. First, the index of vulnerability map. The vulnerability index map depicts the degree of economic, social, and physical vulnerability. The social vulnerability is determined by population density and the proportion of population at a vulnerable age, whereas the economy vulnerability is determined by the proportion of the population that is impoverished, and the table of physical vulnerability contains a percentage of settlement density and the number of high-density centers. So as the result, districts with high vulnerability were Seberang Ulu I, Seberang Ulu II, and Ilir Timur II. According to Acharya and Porwal 2020, similarities between vulnerability and the current concentration of COVID-19 cases at the state levels. So they have same results. As the second result, the adaptive capacity index map. It illustrates the level of services through the distribution of health facilities and employees. So districts with inadequate adaptive capacity include Ilir Barat I, Seberang Ulu I, and Sematang Borang. According to Banik 2020, the absence of adequate testing and hospital resources along with public unawareness and lack of coordination among the various government or private agencies, is likely to result in catastrophic loss of lives. As the third result, the risk map, the Ilir Barat I and Seberang Ulu I are the most susceptible sub-district, as you can see here in black and red color. The number of COVID-19 has dynamic effects on the risk transmission due to the time. In this case, we use September 2021. The Seberang Ulu District 1 has the highest vulnerability and the lowest adaptive capacity. People experiencing homelessness due to SAI 2020 live in environments that are conducive to a disease epidemic. Homelessness live in congregate living setting, such as shelter, houses, or camp, might not have regular access to basic hygiene supplies or showering facilities, all of which could facilitate virus transmission. As a conclusion, the spatial analysis can improve the visualization and prioritization of high-risk COVID-19 location. The treatment advice to lower the curve and to rise the line is designed to aid the speedy infection control. It's recommended that spatial analysis be used by planner and policymaker to effectively prioritize regions for resource allocation and to implement risk mitigation strategies to improve COVID-19 preparedness and response. Thank you for your attention.